Class is regarding the therapeutic contact lenses. So therapeutic or bandage contact lenses. So in market, therapeutic lenses are available as bandage contact lenses. So it's been available as a Greek word that is a therapian, meaning to take care or to heal. So fitted primarily to protect or promote healing rather than to provide the refractive correction. So these lenses are mainly helpful for promoting the healing purpose, not for a refractive corrections. But most are planar powered. You can put the refractive correction directly into it. So classification of therapeutic contact lens types, that is a hydrogel lens, disposable hydrogel, silicone rubber, scalar lenses and collagen contact lenses. So hydrogel lens available as low water content hydrogel soft lens 38% to 45%, mid water content hydrogel soft lens that is 50% to 65%, high water content hydrogel soft that is 70 to 80%. Advantages is to quickly relieve the pain, easy to fit, readily available and relatively cheap, and cosmetic in tinted form. So disadvantage is don't perform well on dry eye, don't enhance the vision of irregular cornea, accumulate deposits or frequent replacement. So disposable hydrogel lens are being used in the cases of recurrent corneal erosions, filamentary keratitis, bullous keratopathy or neuroparalytic keratitis. So advantages can be replaced easily, more convenient and cheaper. Disadvantages is risk of hypoxia or risk of infectious keratitis. Silicone rubber water content is about 38%, highly oxygen permeable, applicable in tear dysfunction lens of choice in chronic and severe dry eyes, or less flexible or improves the acuity. Indication keratinized mucous membranes, trichosis, incomplete lid closure. Demerits hydrophobic lens is there, more expensive, prone to deposits or increased time to settle. So scleral lenses are also available as a bandage contact lens or a therapeutic one. So it is mainly effective in the case of Steven-Johnson syndrome in dry eyes. So demerit is pitfall, lack of convenience has been there. It's been time taking to put the lens directly into the eye and need a special expertise. Selection criteria on the basis of the ocular disorder and availability according to effect on the cornea should be chosen to allow maximum oxygen to cornea unless eye is blind. For blind eye, important consideration is important. Essentials of therapeutic contact lens fit. Keratometry, use of topical anesthesia is avoided. May mask the pain associated with the poor fitting lens. Large lenses for treatment of leaking infiltration blub. So leaking infiltration blub will be given in cases of glaucoma surgery. Healing of peripheral corneal lesion. Fitting criteria. The lens should be fitted so that they move adequately but not excessively. Reduce the movement is desired in condition like recurrent or epithelial erosion. Refitting is required at various stage of recovery. Too flat fit, excessive lens movement, retards healing. Steep lens, little movement, edema and discomfort, trapping of debris will be there. सो एक्सेसिव लूज फिट डिस्प्लेसमेंट ऑफ लेंस. सो जितना भी लेंस लूज होगा तो लेंस अपनी जगह पे नहीं होगा तो इट विल बी मूव. So lens fit be assessed after 20 minutes and ideally again after approximately 60 minutes. So function and aims of therapeutic contact lens. So it will relieve of symptoms, promotion of corneal healing, mechanical protection and support, maintenance of corneal epithelial adhesion and drug delivery. So symptoms relief says provides the more regular refracting surface. Clinical indication is bullous keratopathy, fused endothelial dystrophy, filamentary keratitis, thigation, superficial punctate keratitis, and superior limbal keratoconjunctivitis. So in bullous keratitis, a small bullous or small billet will develop at the level of the epithelium. In fused endothelial dystrophy, the cells or the endothelial cells become less. This filamentary keratitis, it's a severe persistent cases benefit from the use of therapeutic contact lens in conjunction with steroids and atropine or removal of the filaments. In this, the filaments will occur. Disposable contact lens are used such as Wesley JSN Present UV and Acuvue or Boston soft lens 66 and Pure Vision. The superior limbic keratoconjunctivitis is the other side. Alleviate both signs and symptoms of the disease. Relatively large total diameter soft therapeutic contact lenses are used in this case. So recurrent corneal erosion syndrome allow healing and prevents the mechanical irritation, promote the reepithelialization, used on extended wear basis or 2, 3 or even 6 months with removal or replacement only if necessary. A thick high water content extended wear lens is preferred in this case. So ultra thin therapeutic contact lens are the contraindicated. Possible buckling or wrinkling of the lens with lid removement and infective corneal splint action. So chemical injects not used in early stage. Therapeutic contact lens inhibits the passage of certain upon the molecular size and materials and causes degradation and discoloration of lens. So used to deliver drugs such as hydrogels, that is in this we use the pilocarpine, antibiotics, antiviral agents, collagen such as dexamethasone, gentamicin and amphotericin B. Other clinical is filamentary keratitis. It's a severe persistent cases benefit from the use of therapeutic contact lens in conjunction with steroids and atropine or removal of the filaments. In this, the filaments will occur. Disposable contact lens are used such as Wesley, JSN, Present UV and Acuvue or Boston soft lens 68 and Pure Vision. The superior limbic keratoconjunctivitis is the other side. Alleviate both signs and symptoms of the disease. Relatively large total diameter soft therapeutic contact lenses are used in this case. So recurrent corneal erosion syndrome allow healing and prevents the mechanical irritation. Promote the reepithelialization. Used on extended wear basis or 2, 3 or even 6 months with removal or replacement only if necessary. A thick high water content extended wear lens is preferred in this case. So ultra thin therapeutic contact lenses are the contraindicated. Possible buckling or wrinkling of the lens with lid removement and infective corneal splint action. So chemical injects not used in early stage. Therapeutic contact lens inhibits the passage of certain polylactate enzymes. Scleral or silicone rubber lens may be used. A small total diameter therapeutic is the lens of first choice in case of chemical injuries. Whenever the patient exposed to the chemical injuries, just don't use in early stages. So chemical bonds such as Megasoft 220.5 total diameter bicarb therapeutic can prevent symblepharon. So what is symblepharon? Symblepharon is the addition that is formed between the conjunctiva, pulpura or bulbar and in the lens. Scleral lenses or scleral rings can also prevent the symblepharon. Therapeutic contact lenses are also prevent the atropine and trichosis. Corneal ulcers, yes, you can see in the image, it's a peripheral corneal ulcer, that's a Moran corneal ulcer. Long-standing and slow healing corneal ulcer. Hydrogel contact lens is worn continuously with regular use of topical antibiotics. Premature removal retard healing. If peripheral cornea with an epithelial defect, a low water contact therapy is advocated. Mechanical protection and support. It acts as a barrier, protect the cornea from trauma, example in trichosis, protect the new tissue from windshield wipes effect of wild eyelids. So provide the structural support to the weak area, example in desmetocin. Clinical, in this the corneal laceration, corneal perforation, thinning or thus metocele formation will be there. So as you can see, so what is the corneal perforation? It's a hole in the cornea level. As you can see, there is a hole due to which the inner contents of the eyeball is coming out. So corneal wound leakage post ophthalmic surgery. So whenever there will be a cataract surgery or post keratoperatic surgery, that is a corneal transplant surgery, we just with the help of a knife we just give the incision, and due to which the aqueous come out. Sometimes this wound doesn't healed or this incision doesn't healed, so in that case we use the therapeutic contact lens, that is a hydrophilic soft therapeutic contact lens. So maintenance of corneal epithelial hydration, that is a scleral silicone rubber and hydrogel contact lens be used. Sealed scleral lens have ability to hold reservoir of fluid, protect the eye by retarding evaporation. Thick and low water content is preferred in this case. So this is the case of Steven-Johnson syndrome, in which the oculopemphigoid chemical burns, trachoma, dry secondary infections will be formed. So provide slow and prolonged delivery of low dosages, depends upon the molecular size and materials and causes degradation and discoloration of lens. So used to deliver drugs such as hydrogels, that is in this we use the pilocarpine, antibiotics, antiviral agents, collagen such as dexamethasone, gentamicin and amphotericin B. Other clinical applications is protect the cornea during the procedure like tonometry, specular. Protection of epithelium in diabetic patient while photocoagulation, that is a laser. Increase comfortable when hydrogels is worn under the rigid gowns in piggyback fitting keratoconus. So managing patients with 5th and 7th cranial nerve, in 7th cranial nerve facial nerve palsy developed, due to which the eyes will be unable to close. The patient is unable to close the eyelids and may develop exposure keratitis. So in that case we can use the therapeutic bandage contact lens. After care is clean, disinfect and reinsert the lens on each with a replace if needed. Frequency of follow-up variable as per patient's condition as suggested by Austin in 1989 is 1 day, 3 to 7 days, 1 month, 2 to 3 months for after care visit. So this is about the class. Thank you.